So the goal of pediatric nursing is to improve the quality of healthcare for children and families. As of 2011, children ages 0 to age 17 made up almost 24% of the population. 24%, that's almost a quarter of the population. That's 74 million children, and that was just in 2011. What have we improved on? Well, we have increased vaccination rates, we have improved child health outcomes, we have decreased adolescent pregnancies, kids wear bicycle helmets now, they use car seats, most people generally have smoke detectors. But what do we still need to work on? Well, regular access to health care and regular access, children need health insurance too. Why? Because if we don't have health insurance, then children aren't going to get medical care except acute care, because preventive care gets lost. Children who are not covered by health care or health insurance generally don't go to the child or don't go to their pediatrician for well child checkups. They just go to the ER for cases when they are acutely ill. We also need to work on better pediatric nutrition. We see a lot of childhood obesity these days. It's not that undernutrition is a problem, maybe overnutrition is a problem, or children who are not eating the right things. We also need to improve our dental care. Ooh, for those of you who have done school screenings, if you've looked in the mouth of children, whew, they definitely have deficits in their dental care. Sadly, dental care is one of those things where, if parents are strapped for money and something has to go, it's going to be the teeth. There is a philosophy that you don't really even need to go to the dentist when children have baby teeth because, well, they're just going to lose those teeth anyway. So why do I care about taking them to the dentist? Why do I have to worry about doing any of those things? Vision services are often left behind as well. Again, if push comes to shove and you have to make choices between keeping the electricity on in your house or buying your kids some glasses, well, you're going to choose to put the electricity on in your house. And you can't fault parents for that. I mean, it is what it is. Money only goes so far. And unfortunately, vision care and glasses are expensive. We also do need to, we still need to work on immunizations. We've got well, I shouldn't say huge, we've got a growing sect of the population who are anti-vaxxers. I'm not going to get into a debate with those of you in class if you are pro-vaccine or anti-vaccine. It really doesn't matter. I don't bring my personal views and bias into this, and you shouldn't either. But we do need to work on increased vaccination rates. I kind of already mentioned obesity and type 2 diabetes, but yeah, we need to work on that issue. We also need to work on childhood injuries, choking, drowning, firearm accidents, burns. Those are issues. Substance abuse is a concern. And sadly, one of the biggest things that is being overlooked right now as far as pediatric health issues is mental health. We have increasing rates of teenage suicide. Plus, we have increasing incidence of ADD, ADHD, and ODD, which is that oppositional defiant disorder. Where do you even begin to care for children? Many causes of disease and disability and death in children, such as prematurity, nutritional deficiencies, injuries, chronic lung disease, obesity, pediatric cardiovascular disease, depression, violence, substance abuse, and HIV and AIDS can be significantly reduced or prevented in children and adolescents by addressing these categories. Address tobacco, substance, and alcohol use. Address the behavior that results in injury and violence. Examine dietary and hygienic practices that cause disease. Address the sexual behavior that causes unintended pregnancies and disease. And then reduce the sedentary lifestyle in children. What is the overall effect? Well, I'll let you read that for yourself. All right, so the CDC publishes these goals for the public called Healthy People. You will learn more about Healthy People goals when you take Community Health, ASN 240. But for now, just know that the CDC makes these goals. These are very broad goals that they establish to provide a framework for the essential components of child health promotion. So the Healthy People Goals. These are the goals that the CDC wants to have accomplished by the year 2020. So I'll let you read through those on your slides. Interestingly, a child's food preferences are established by family influence and culture. In the adolescent years, children make food choices related to peer acceptability and sociability. Generally speaking, low-income families lack the resources to provide fresh fruits and veggies and adequate protein intake. What food stamps does seem to cover are a lot of processed foods and carbs, which leads to obesity and health problems for children. If you think about it, does food stamps really cover a lot of protein and fresh fruits and veggies? No. Food stamps generally covers boxed and canned items, which is all processed food and which is not healthy for kids. If children are malnourished, they have growth and developmental delays, depression, and behavioral problems. Look at that statistic about children and cavities. 1 in 5 between the ages of 2 to 4 has visible cavities, cavities that you can just see when they open their mouth and you peek in there. Who's at highest risk for this? Again, we're going to be looking at the preschoolers of low-income families, probably, because they are on food stamps. They probably also eat high sugar foods, and they probably don't have money to visit the dentist. This population may also lack education about oral health. Now, I'm throwing out a lot of generalities on here about low-income people. And it's just a generality. There are always going to be exceptions to every rule. Not every single low-income person lacks education. Not every single low-income person only feeds their kids, processed, boxed and canned food. Not every single low-income family, doesn't find money for vision screening and the dentist. These are just generalities. So everybody just calm down. What can the nurse do? What do you guys need to do as the nurse? Well, educate children and parents about oral health. Encourage, drinking of fluoridated like city water, and try and get them access to health care. Dental care. Nurses may also screen for visible cavities and set up dental visits on a priority basis. There are places within Greene and Christian County and in surrounding counties that will provide reduced cost or even free dental care for children. There's a place in Ozark I know that does it, plus there's the Ronald McDonald Tooth Truck. Oftentimes these trucks make rounds to schools to try and catch kids at school because maybe their parents aren't able to get them to the dentist any other way. And they will see kids and treat kids based on a highest priority need basis. And guess who makes those referrals? Oftentimes the school nurse does. The 2 public health interventions that have made the biggest impact on world health are clean drinking water and immunizations. No surprise there. Because if we have clean drinking water, well, that's going to keep us hydrated. That's step 1 in being healthy. And immunizations against, common diseases that just normally wipe you out and kill you, well, that's step 2 as far as staying alive if you're a child. So again, what is the nurse's role here? Review immunization records, take every opportunity to vaccinate when possible. It is very tricky sometimes when you're dealing with low-income families. If the child comes in and they are to see the doctor and they happen to be ill and you notice that they are due for a vaccination, unless there is a major reason why you shouldn't do it, go ahead and vax them while they're there, because the parents may not have enough money. They may not have a cab voucher. They may not have the resources to come back and get the immunization when the child is well. And then you can also try and give parents resources to stay current with immunizations. Give them, if you can cough up some taxi cab vouchers or bus passes, do that. Tell them about the hours of the health department where they can get free immunizations. Give parents resources because most parents want to do the right thing. Everybody wants their children to be well and healthy. So give them the resources that they need so they can be successful. Not surprising, childhood obesity is increasing in epidemic proportions and of course leads to type 2 diabetes. In children, Obesity is classified as a BMI greater than the 95th percentile for children of the same age and gender. Between 1980 and 2000, the incidence of overweight adolescents has tripled, according to the American Dietetic Association. Overweight youth have an increased risk for high cholesterol, insulin resistance, diabetes, hypertension, and heart disease. But what else has contributed to childhood obesity? Increased screen time from TV, video games, iPads, tablets, and computers, yes. And the other simple truth is children do not play outside as much anymore due to how unsafe environments are, and they just simply lack exercise. Many households are dual income now, and children may not be allowed to play outside after school or on the weekends until one parent is home from work. And you can't fault parents for that. I don't let my children play outside unless I am at home. The world that some of us grew up in, where we could play outside, from morning until the streetlights came on, is just not here anymore. There's too many creepers, there's too many, people trying to, prey and kidnap children. It's just not safe. And so parents, in the interest of trying to keep their children safe, make their kids stay inside unless they have time to go outside and actually physically see them and watch them play, which is good because, you got to admire parents. They're keeping their children safe, but it's kind of bad at the same time because now kids aren't getting the same, exercise that they used to get. So again, not faulting any parents here. It's just the world that we live in today. Injuries. MVAs are the number one cause of death in children over the age of 1. So many children are not properly restrained in a vehicle. Other injuries include choking and drowning, fires, firearm accidents, poisonings, accidental suffocations, pedestrian and bicycle injuries. We see a lot of those in the spring and summer. And as far as violence goes, there are significantly higher homicide rates among minority populations, specifically African American children. The cause of violence involving children is not understood, but it is a high priority concern for every sector of American society. What nurses can do is monitor for abnormal behavior that might suggest violence, such as harming animals, starting fires, depression, repeated incidents of trouble at school, or hanging around other groups of children who are repeatedly in trouble. Risk-taking behaviors, especially with boys, tend to start in adolescence and continue into young adulthood. Things like drinking and driving, high-speed driving, carrying a weapon, using illegal drugs, these would all be considered risk-taking behaviors. So this is these become a childhood health problem. Mental health problems, 1 out of 5. That's a high number. 1 out of 5, 20% of adolescents have a mental health problem, and 1 out of 10 has a serious emotional problem that affects their daily living. Children with mental health issues are more likely to drop out of school. Suicide is the third leading cause of death in children ages 10 through 19. Suicide! Man, can you believe that? There are between 11 to 12 youth suicides per day. All right, so what is the role of the pediatric nurse? Well, to provide family-centered care. What in the world is that? Family-centered care means that you understand that the family is the one consistent thing in a child's life. So, we make partnerships with the parents and families. This means being non-judgmental. This means helping when you can help and accepting the things that you cannot change. 2 of the basic concepts with family-centered care is empowerment and enabling. Empower families and help them gain a sense of control over their family and reinforce positive behavior. Enable families with every available resource that you can. Another role of the pediatric nurse is to provide atraumatic care. That just means that the care that you are providing is in the most child-friendly way possible. We do this by minimizing parent-child separation because kids don't like to be separated from their parents when they're in the hospital. Sometimes they don't even like being separated from their parents anytime, but especially when they're sick and in the hospital. We give the children a sense of control when possible, and we try and prevent and minimize bodily injury and pain. Advocate, 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 advocate. Didn't we learn about that when we had our speaker come from the Child Advocacy Center? Advocate for all available services, treatment options, and healthcare services for that child. And then, of course, establish a therapeutic relationship with the family and the child. Moreover, establishing a therapeutic relationship means the pediatric nurse must have a meaningful professional relationship with the child and their family. It means being an advocate. Help the family find the resources that they need. Keep them involved in the care and make sure they are aware of the care and treatment plan. Strive for disease prevention and health promotion. Do the developmental screens, monitor immunizations, assess dental hygiene, safety, peer interaction, family discipline, and education. Offer suggestions, constructive, helpful suggestions as needed. As far as healthcare teaching goes, teach parents about the diagnosis and the treatment. Teach children about their condition. Provide literature. Provide anticipatory guidance. Make sure that you teach to the appropriate age and developmental level, not only for the child, but for the parents as well. Not every single parent, adult, is going to be on the same developmental level, so you have to adapt. As far as injury prevention goes, again, education is key here. Ask parents about their home so you can assess what dangers might be present for their child. As far as support and counseling goes, sometimes being a listening ear is all that a parent or child really actually needs. Be supportive, be empathetic. You may connect with a family, or you may need to connect a family with a counselor who can better help them. Coordinate and collaborate care with other disciplines, both while in the hospital and upon discharge. Ethical decision making. Be aware, and I think you guys all probably understand this already, ethical dilemmas arise in pediatrics. It might be due to religious reasons, it might be due to cultural reasons. But your job as the pediatric nurse, remember I said you have to be non-judgmental, your job is to be supportive and respectful as you can while still being an advocate for your patient, and you better jolly well stay within the scope of your practice.